I think the biggest issue is nobody plans on orthopedic trauma. People have hip arthritis or knee arthritis, and they can plan, I'm going to have a surgery on Friday, I'm going to be out of work for 3 weeks or whatever it is. Orthopedic trauma just happens to you. You're minding your own business and you slipped in the driveway, or you're hit by a car, or you fell off the roof, or whatever it was. Like, you don't plan on orthopedic trauma, and this happened, and now we're going to help you get through it.
So when people think of orthopedic trauma, people think of oftentimes, bad car accidents where you've broken everything, you're in a cast for weeks. But it can also be, hey, I tripped and fell and broke my ankle, or I slipped on the ice, which we see not infrequently in the wintertime here, and broke my wrist. So it runs the whole gamut, but we have special training in complex fractures and getting fractures that heal incorrectly or don't heal to heal.
All orthopedists, we're basically bone and muscle doctors, so any kind of injury, any kind of trauma, you might see an orthopedist for it. Orthopedic trauma generally is the more complex one, so if you break your ankle, a foot and ankle doctor might take care of that. If you break just above that where it involves the articular surface more, perhaps that's when you'd see the orthopedic trauma person. So not only did you get your arm, but you got your ankle and your pelvis and your thigh and whatever else. We're more the inpatients doctor, so if somebody hurts their ankle, that's generally fixed as an outpatient, where for the trauma stuff, you broke your pelvis or your leg's really bad, you're stuck in the hospital until you get those fixed. Your orthopedic trauma person is probably the one that's going to fix those for you so you can go home.
Common treatments we often see if the aging population falls and hip fractures in the elderly, and some of the common treatments for those may be intermedullary rods and screws to help through small incisions, and x-ray to help it to heal. Certain fractures do better in terms of regaining function with either a half or a total hip replacement. Femur and tibia fractures, we often treat them with intermedullary rods, or oftentimes intermedullary nails, which is really one of the more amazing treatments, where you have someone that broke their femur, one of the strongest bones in the body, and in the old days would be in traction in bed for months, and now we can do a surgery and insert a rod and they can get up and walk the next day. Then from fixing either wrist fractures or ankle fractures, oftentimes around joints, where it's more important to restore the integrity of the joint for function and to prevent arthritis, we'll often do larger approaches and plates and screws, getting all the pieces back in the right spot.
Tremendous progress has been made over the last few decades, last few years. A lot of it's minimally invasive. So back in the 70s and 80s, people got really long skin incisions, and they would take too much of the muscle off the bones. Now we can make small wounds and percutaneously fix things and rearrange the alignment of the leg or arm so we don't have to make big wounds. Doing less soft tissue damage, things recover faster. And it's easier on the person, and things have moved from being in the hospital for weeks and weeks to maybe it can be done, just stay overnight or not at all. So the first thing patients should know if they're in a major trauma is that although this is the first time they've had that injury, that the team, the hospital, and the surgeon, we've probably seen this many times, and we'll help you get through it step by step to get you back to your life and doing all the things you want to do.